Hello, welcome to the Center for Automotive Research Arsenal of Health webinar. We'll get started promptly at 1 o'clock. Stay tuned. If you're just joining us, this is the Center for Automotive Research Arsenal of Health webinar. 1 minute to go. Hello, good afternoon. Thank you for joining the Center for Automotive Research Arsenal of Health. How automakers and suppliers are stepping up to support the medical response to the COVID-19 crisis. First of all, I want to give you a heartfelt welcome, and I hope that everyone and your families are healthy and doing well. These are trying times for us all. It requires a level of empathy, I think, for our family, for our employees, for our companies, our businesses that we haven't experienced probably in our lifetimes. And for those people who are working from home, as well as trying to do teaching for their children whose schools are canceled, my hat is off to you. That's truly tremendous, and you all deserve a badge of honor for doing so. So if we think about, the automotive industry, and probably most of you are joining because you are part of that industry or care about the industry or are simply reporting on the industry. I don't think anybody could have expected back when we heard the issues happening in Wuhan that we would be experiencing the same thing here at the same level. And as a result of that, the work that the automotive industry is doing, already stepping up to supply quite a bit of equipment and supplies to the medical community, has simply been outstanding. Not only the big OEMs and the tier ones, but as we go down through the supply chain, even small and mid-sized manufacturers are beginning to step up and say, hey, I can do this. I have this equipment. How can I help? And it's really quite amazing to see this outpouring of support for the people working on the front lines to make us healthy. And if we think about really the rationale behind that, the sooner that we can get America and the world healthy again, the sooner we can resume our business as usual and begin to recover from not only the personal sacrifices that we're all going through, but the economic sacrifices as well. When we think about this being a global pandemic, many of the companies in our industry are actually global providers, and they have the opportunity to learn from areas that have already been hit. We've already seen a number of manufacturers in China or who have Chinese operations stepping forward to provide essential supplies from China. And also some of those best practices, now that those countries are beginning to ramp back up, what are some of the lessons learned in terms of preparing our manufacturing facilities for when we can actually resume production again? What are some of those hands-free solutions? What are those hygiene solutions we need to be thinking about? So far, there have been 12 automakers and 9 other companies that have stepped up to support the health institutions with supplies. 20 of them are in the US, 8 are in Europe, 5 are in Asia, and 1 is in Canada, and those are growing numbers. They grow day by day. There are 10 of them that are doing PPE equipment, 8 are service providers, 7 are doing medical devices, and then there are a number of others that are working either with cash donations or volunteering. The outpouring from the industry has been tremendous. As we know, the president did invoke the edict last week. Fundamentally, the automakers were already stepped up, including GM. So the bottom line impact of that is it didn't make a difference to what the companies were doing in terms of doing the right thing. Similar to the US, Canada has started a number of initiatives. There's really a war. There's a war on this virus, and it's a war that we haven't fought. It's a war on our own shores and with our neighbors. And the rallying together that we've seen not only from our industry, but from a number of industries, a number of foundations, a number of persons within our community has really been amazing. And it really requires that kind of solidarity for us to resume where we all want to be. So fortunately today I do have a couple of guests. I'm going to do a little housekeeping first, so bear with me. Right after this webinar, we will have a recording on our website, www.cargroup.org, and please feel free to take a look at that. And as you may know, CAR is a 501c3, and all of the work that we're doing related to COVID-19 research is unfunded. We do have a link on our website if you would like to provide a donation to us so we can continue to do the work, the research, the status tracking for the industry to again show what the industry is doing, how much it's stepping up, and what kind of an impact it's having to our medical community. That would be sincerely appreciated. So at this stage, I'd like to introduce Julie Freem, who's the CEO of OESA, and Colin Dillon, who's the CTO of APMA, and APMA is the Automotive Parts Manufacturers Association, and welcome them to the program. I have a few queued up questions that I will start with and go back and forth with the panelists, but we really would appreciate receiving your questions. So please, you can submit those in the Q panel, which is on the far right-hand side of your screen. So with that being said, I'm going to stop showing my screen, and we can get right at it. Welcome, Julie and Colin.
Thank you.
Thank you for having us.
So I gave a little bit of an intro, not nearly comprehensive enough about everything that is happening in the supply base, in the OEMs, in the different countries. Both of you are deeply engaged and working tirelessly. I know many of us have been involved on the weekends, lots of hours. Can you take a few minutes and kindly explain what you're doing, who's involved, what's the processes, and give us a summary of how it's working for you? Maybe we'll start with Julie and then go to Colin.
Okay, thank you, Carla. Good to be with you today, and thank you to the CAR Group for having me. And of course, Colin, good to join you in this. A little bit about OESA in terms of what we do and how we do it. Of course, we're also a trade association for suppliers, similar to what Colin's organization is. It's the Original Equipment Suppliers Association. And so our job is to provide timely information, data, to the suppliers that help them make their business decisions, and really provide them a competitive edge as they look in their fields. And then also, of course, in this day and age in particular, it's very important that we're advocating on behalf of our supply base. And so we spend a lot of time in Washington, D.C. with various organizations as well as the legislative group. They're advocating on behalf of suppliers and what they need, particularly in this great time of need. We have a number of things going right now in terms of different areas that we're working on. In the information world, we are also, like Carla, having many webinars to educate suppliers about what's happening and to make sure that they're staying in touch with their peer groups and understanding the data that's available across the industry. We also are working hard to advocate together with our the OE Association, which is the Alliance for Auto Innovators, and the OEs and suppliers. We have work streams going with that entire group where we're looking at better supporting and improving our ability to support as an auto industry and medical devices and PPE, as well as looking at the health and safety standards that need to be implemented across the supply base when they come back up and begin to run again.
Thank you, Julie. Colin, what's happening in Canada and how is APMA involved in that?
Thanks, Carla. Well, the Automotive Parts Manufacturers Association has been around supporting the auto sector for over 68 years. It's done through advocacy similar to Julie's organization, and over the past few years, as the vehicle and its platforms begin to become more technology-based, you have individuals like myself that have been brought on to help with the connected, autonomous, cyber industry 4.0 initiatives. But as an association, we are there to make sure we advocate on behalf of our supply chain, both provincially and federally here in Canada, to make sure our sector has a strong voice. And I think back in January, I would say, when a number of us were probably traveling globally to different conferences, we did hear about COVID-19 in certain parts of the world. Some of us did try and get masks before certain trips, but it still felt like it was not our problem, it was somebody else's problem. And now, less than, I would say, 3 months later, we're all extremely and heavily affected. And so the challenge has been, and we've taken that, and our president here, Flavio Volpe, about, I would say, 2 Sundays ago, gave us all a quick call on a Sunday to say, we're going to mobilize the auto sector and we're going to mobilize our supply chain to support, and we'll have more information to share on the following day. And so since then, Carla and Julie and everyone listening, I'll be honest and I'll be very frank, I work hard, but I don't think I've worked this hard in probably 3 to 4 years in these past 2 weeks. I tend to have my laptop on my lap until about 11:30 every night. But it's all okay because I think everyone's banding well together, where I think we're all trying to do what needs to be done. And it is, we've got to commend our sector, both the OEMs and the supply chain, for stepping up the way they have. And I'm sure the stories we're going to share of what Canadian suppliers are doing are going to be similar to what some of the auto folks are doing south of the border.
Colin, can you help us to understand a little bit more about what's happening in Canada? In the US, we often tend to only hear about America, and we don't have that global brain in our newscast, unfortunately. But are you experiencing the same thing with certain areas being hotspots, like Detroit is here, for example? And or do you see impending hospital shortages, and are you beginning to set up temporary hospitals that will eventually need this equipment?
So Canada is geographically an extremely large country, as everybody is aware. Population-wise, we're about 1/10 of the United States. We're about 37 million. And the joke is you can normally just kind of look at the map of North America and draw a line just above the United States of America to Canada, and that's pretty much where we're all populated. There have been some initial hotspots of the provinces. The numbers in Quebec were on a larger, growing in a larger scale. Initially, British Columbia on the West Coast was as well, but they've seemed to have controlled their numbers this past week. And the more populated province of Ontario, where I am, their numbers are also on the rise. I don't think there is anything quite like what we're seeing in New York State, but we all recognize, our leaders provincially as well as federally, that these next 2 weeks are going to be critical, because those that have come back, because it is a spread, it's not an airborne disease, it is being spread from person to person. And the global connection, the global village that we are today, it means that people coming and going from different parts of the world have been, carriers, for a lack of a better description. So with that lockdown, the next few weeks will really show where we stand, and also if the communities are keeping social distances that are being recommended. And as you and I and Julie were chatting earlier, Carla, off the call, we do expect more stringent social distancing rules to be implemented here in Canada, specifically, I know in Ontario, over the next 24 hours. What is positive is how well this sector has stepped up. Yes, there is a shortage. Part of my research over the past few weeks has been the support in ventilators and some PPEs. Globally, the United States, for example, in my research shows they have over 185,000 ventilators throughout the country. In comparison, Canada has 5,000. The United Kingdom has 22,000 for adults and 6,500 for children. You can start to evaluate the numbers. We have been told that if the trajectory doesn't flatten out and Canada begins to resemble some parts of Europe, by June/July, we would be in need of approximately 80 to 1,000 ventilators. The positive is, yesterday we announced the challenge first, and then the positive. The challenge is a lot of these medical companies that manufacture things like ventilators, whether they're transport types or ICU types, their annual volumes are a fraction of what our world is normally used to. And so a company that may sell 3,000 transport/ECU type ventilators, that's a large volume order. They are not used to the hundreds of thousands and the millions as we are in our world. So yesterday, Magna, Linamar, Martin-Rear, and ABC Group Technologies were announced as a support team that will be helping a local company here in Canada called O2 Medical Technologies to ramp up, and an order of 10,000 ventilators was announced that will be paid for by the province. We expect similar announcements to come from the federal government for a similar volume, but then if you put the numbers together, we're at about 25,000 ventilators by maybe June. We're still short. We're still only a quarter of where we probably need to be by July. From a PPE standpoint, our focus has been on N95 masks and ASTM3 level masks, as well as face shields. Again, there should be some announcements. We have companies like Woodbridge Group who have been stepping up and are a few medical clinical approvals away from hopefully launching a product, a mask which they can make something in the terms of 4 million units a week. We've got a 3:30 call today with the federal government and a contingency of companies that include ABC Group Technologies, Magna, Windsor Mold, Mitchell Plastics, names that I'm sure people that are on have heard or maybe a part of. Axion and a few others, and even one food company out of Delta, British Columbia, that are all teaming up to say we can produce high volumes of face shields. And so how many face shields does Canada need? Well, the federal government believes it needs between 10 to 20 million by July.
Mhm.
because you may be able to wear your PPEs, including a mask, but the importance of a face shield means that any, aerated, smaller than 3 microns of COVID-19 that is propelled towards you could be prevented from even touching your mask,
Mhm.
which there is a
Right.
tendency for frontline workers to touch their face when their gloves are off. So all of these things are happening real time. It is really exciting, and we are really proud of the movements that have been made, not only by our members, but also by the federal and provincial government. We have been told that we have full support as we go through this process.
That's excellent. Thanks for sharing all of that. And one thing that I found very profound, since they told us you shouldn't touch your face, I cannot tell you how many times I do that during the day. It's amazing what you realize your self behaviors are. So you talked a little bit about actual products that the companies are working on, ventilators and PPE equipment, mainly masks and face shields. But interestingly enough, you also brought up how they're helping the medical companies with their production ramp ups and helping them with their manufacturing processes. So let's just talk about that for a minute. And Julie, I'll start with you. What is the scope? We hear a lot about the medical devices themselves, but it's much larger than that.
It is much larger than that, and there's a lot of expertise that the auto industry brings to bear. And Colin, you started to touch on it, whether it's the purchasing power and ability that the organizations have. It's the ability to manufacture in large quantities and to improve efficiency on some of the existing production lines that perhaps haven't had that demand on it in the past, and now are trying to step up and do as much as they possibly can. So there are suppliers and automakers lending their expertise to these companies just to help them with lean manufacturing, or some of the other things that they can do to improve their own production lines before even going out to talk to suppliers or talk to OEs about making product for them. I think one of the hidden heroes in all of this is some of the smaller tier 2 and tier 3 manufacturers that are doing a lot of the components for what's happening in the industry right now. GM has talked about their ventilators, and it's over 600 individual components, and they were able to source those over the course of 48 hours. That's amazing, and that's the supplier community stepping up to volunteer and support that effort. And it may just be a bearing or a small plastic part, but they all have to come together. And that's the capability that GM brings, is that ability to bring it all together, to source that many components in 48 hours, and to really carry that load forward. And the same with Ford and others that are doing ventilators. We know that's happening, and they bring that knowledge and capability to the party.
Mm-hmm. And is it a similar scope, Colin, that you're dealing with, not just the parts that you mentioned, but also all the different processes to enable greater volumes and more efficiencies?
Yeah, and again, our sector is well known for efficiencies. We all know the givebacks we have to do on an annual basis to our OEMs. So but the challenge is so Medtronic, which is one of the largest medical companies globally, released their PB560 ventilator IP on Monday. I went through the package, some of the PDFs explaining the technology were over 200 pages in length. I evaluated it because there are others that are interested in building ventilators, and there are only so many companies that can help one ventilator company. But the challenge with a Medtronic's PB560 ventilator and the open source is, unless you've got some of that medical manufacturing background,
Mhm.
you really are going to be starting from scratch, and the ramp up could be weeks/months. And so we are trying to, we're working with McMaster University, a local university here in Hamilton, Ontario, and there is a consortium that have come together where there are people with medical backgrounds, technical backgrounds, OEM backgrounds that are looking at coming together to maybe tackle and look at building something like the Medtronic's open source ventilator.
And one of the things that I keep hearing from some of the smaller manufacturers especially, or even some of the larger ones, is we want to make sure that the equipment that we do make is usable. You know, we don't want to make something that doesn't meet the spec or the standard and we get told that's nice, but we can't use it. So how are we improving those lines of communications from those that certify the devices, manage the quality control, and allow that to get into the processes so that, again, we're sure that what we're making is usable at the end of the day?
From our standpoint, we are looking to tie into what FEMA is doing and work with them so that we understand, to your point, Carla, the demand side, what is needed, and how should that be deployed into the manufacturers that can do this and can support it. Part of what allows us to do that is if we subcontract that work from the existing medical device and PPE organizations, meaning we work within their designs, their technology, supporting what they need to do to deliver to the industry what the industry, in this case, medical devices and PPE need. There are, in fact, some efforts where we are individually producing things like masks or face shields, and understanding where those are going to be used allows us to work within those guidelines. So we have to be very careful that we understand where product is going to be used as we actually manufacture it.
And we've been quite fortunate. We've got daily conversations between Flavio, our president here, and the federal government and Health Canada. And so we've made sure that before we have an influx of, hey, I want to build this, but I don't know if I need a clean room in order to build it, we're trying to get specifications provided by the federal government and Health Canada for all the different PPEs and products. And so, for example, face shields don't necessarily need to be manufactured in a clean room, but PPE must be worn by those assembling all the components of a face shield, whereas a mask may require a clean room. So we're a small team here at the APMA, but we've all kind of taken certain segments, and so colleagues have been focused on clean room, others have been focused on pulling in specifications and guidelines and best practices. We've been working closely with 2 or 3 local hospitals and their physicians, frontline workers. And so bringing it all together, we're making sure information is not only provided back to the governments, but also to our members and broader. So, you aren't, like there is a lot of 3D printing of face shields at the moment with extruded polycarbonate or polyester or PETG films. It's fantastic. It's a feel-good factor for all those that are involved. But the reality is when the Canadian government says we require, say, 15 million, then and the cost needs to be, say, under $3 or $4 Canadian, then some of these face shields, which are, I think, in excess of $7, and the volumes can't be met, then suddenly they've played a role locally, maybe to support local hospitals, but for the larger battle, it needs to go to the mass-produced experts, which are our members, Tier 1, Tier 2, and Tier 3.
Yeah, let's talk about the economics just for a minute, if we could. I know I've heard several of the large automakers, Bill Ford came out and said, we're not even thinking about money right now. We're just thinking we need to provide this equipment to battle this war, so to speak. But economics play a role, and they're going to play a role as production facilities are closed. There's no income coming in. So, how are the suppliers, the OEMs, how are they ready to handle that? And, what's everyone kind of thinking right now in terms of, there was the CARES package that was released. The good news is many of the OEMs and suppliers are in better shape than they were the last time we went through a recession. But just what are the thoughts right now on the money side and the economics?
Well, certainly cash flow is the concern. And when you talk about the financial side of what's happening, and because the industry is shut down, that's the ongoing concern for suppliers as well as OEs, that understanding what's going to happen in terms of their financial cash flow. However, when you talk about this from a standpoint of making a product for the medical device industry or PPE, especially for suppliers, and looking at that, overall, it's a relatively small portion of what they do. And so there's a true feel-good factor in this that's important. There's also the pulling together of the workforce behind this and the team of people supporting this. So I think many suppliers have looked for volunteer workers during this time. They've done some unique things to manage what you're talking about in terms of the cost basis. Certainly, if we talk longer term and mass production, we're going to get to a different stage. But right now, to Colin's point, 3D molding these face shields or doing some things like you said, Colin, those are things that the companies are willing to participate in right now just because they see the tremendous need in the medical community.
We've already seen it's the largest check being cut by the province of Ontario for procurement, which was last week, just under 100 million for these ventilators that were placed as an order. And the challenges of who cuts the check and which department or ministry does that money come from was an internal challenge that we heard our province had. I think we're in for the long fight. When I used to kind of run advanced product development, I used to talk about ideas 1 to 3, 3 to 7, and 7 years plus. Whatever we're working on, I need to make sure we've got things going on now. And who's now? Now used to be my sales team who wanted to walk into General Motors now with something brand new. What are we doing in 3 to 7 years? And 7 years plus was what I always used to describe, because I come from a plastics background, is that's like putting bubble gum into an injection molding machine to see if it actually makes something. And so with COVID-19, I think we're probably looking at the long fight as well. And hopefully it's not years, it's months. But they are talking about multiple waves, and we are looking at, let's say, an end timeline being a vaccination that may be available, fingers crossed, later this year or early next year. And so if we put that into context, when will the OEMs be back up and running is a question mark. We've heard dates of this month being thrown and floated around.
Yeah.
It will be interesting, and I think we'll talk a bit more about that specifically and how we can manage that later on. But I think the challenges are cash flow for sure, as Julie mentioned, and the fact that companies are having to potentially lay off thousands and hundreds, tens of thousands of employees, which may be short term, but the concern is that what happens after. I think we can all agree, some of the challenges we're facing, and I'll be, again, one thing I've always been is quite frank, and working under Flavia for nearly 2 years, I've become even more franker, if that is such a word. The cost of an N95 mask 5 months ago was 70 cents US. I think we're paying over $7 a mask because certain countries and
Mhm.
jurisdictions are charging it. So I think when the dust settles and we get back to some normality, I think we will see production of goods and services coming back to our shores versus being caught, as they say, with your pants down, which is the way we all feel at the moment.
Mhm. I just have another interesting story when you were talking about long-term plan, you know, being 7 years and beyond. I have an uncle that's 87, living with his 84-year-old wife, and they're totally homebound, not even getting their mail till it sits out for X amount of hours. When I was talking to him on the phone, he said his new long-range plan is 24 hours. So that's all they're thinking about is let's get through the next 24 hours. And I think many of us have started to shift that way a little bit, but you just never know what's going to happen in the next 24 hours. And we just need to be prepared to react as an industry and as a community. When we think about all these extraordinary things that the industry is doing, and you mentioned advocacy, that you're both talking to the government. How will advocacy help? Advocacy help with the economic stress? Advocacy help with just the general goodwill for the industry? You know, what are those things that you're advocating for on behalf of the industry right now? Maybe reducing some of the other economic burdens, USMCA, et cetera.
Well, there's a whole host of things, and I think even working with Flavio and Colin and APMA, we are continuing to work on USMCA. So that is one thing. Certainly right now we understand entry into force has just moved back until July 1st for us in the United States. That, given everything else that is going on, that is an extraordinarily difficult task. So part of what we are advocating is that on behalf of the supply community, as well as all the entire auto industry, we need to have a later date in order to be able to accomplish that in a efficient and effective way. So that's really important. I want to go back to, though, part of the COVID-19 crisis and the stimulus package that just went through Congress here in the US. We were heavily involved in helping craft initial ask and putting the size of that ask together and the basis of that ask in front of both the House and the Senate. And then as it progressed through the negotiations, it became clear to us that we were leaving out a number of the middle, I'd call it mid-sized suppliers. There was the SBA part, which we now know and understand, but the larger company portion of that initial stimulus package did not include some of the mid-sized companies, a little bit bigger than SBA, but not big enough to be what you might consider large. And we advocated very heavily to make sure that those monies would be available to all suppliers, regardless of where they are in that annual revenue mix. So that is another thing. One other point, and I know, Colin, we're all involved in this, is the auto industry, and this is no surprise to the group on the phone now, but the auto industry is certainly a global industry. And we must all come up to speed and work together in order to be able to support our industry, whether it's in the US or Canada or Mexico. It's all interconnected. And we have conflicting and different essential business definitions, ways that we're looking at when the industry can restart. And we need to find a way to work together and to come up to speed in an organized fashion so that it is as smooth of a restart as we can put in place.
I spoke to my father, who lives in the UK this morning. He's 74. He's aware, but I told him a few weeks ago, you don't leave that house, you stay in, and you let my brother and his grandchildren help him out wherever he needs to. And then this morning's conversation was about how there are three generations that have never been through a world war. I grew up in the UK reading books, still seeing neighbors who had token books that we used to buy goods in the 50s and early parts of the 60s. And so, and we talk about a period from 39 to 45 where, if you were in London, UK, you were being bombed at night. And so you would leave your home and go into the underground subways to sleep, and then get up in the morning and go and build. Instead of making pots and pans, you were building, cartridges for bullets and bombs. We've been fortunate these last three generations to not have to go through anything like this. And I think the advocacy portion, that the APMA is doing on behalf of its members is being echoed by our Prime Minister, who mentioned the APMA last week on his daily updates, by the Premier of Ontario, who asked Flavia Volpe to come and join him on stage last Saturday as he made announcements. And so, what packages and how things unfold when the dust settles, we're pretty confident that the goodwill that our sector has put in, and I don't believe it was done on the premise that we should be able to get something out of this. I think there was this general, like, if you see the amount of emails, Carla and Julie, that I get on a daily basis from individuals and companies that I've really not heard of in our sector, it amazes me. And most of them aren't even asking for any money. How can we help? Very few are saying, well, which grant could I apply for in order to support what we want to do? And so I think when that is echoed and reported back, I think it would be good news for our sector and hopefully a broader sector, as Julie mentioned, the NAFTA sector.
I actually, for the audience, I'm actually taking some of your questions, so I'm paraphrasing, but this is one that keeps coming up repeatedly, so I want to ask it directly, and it's about employment and some of the companies at risk. So we recently had a study that CAR issued that 75% of suppliers have fewer than 100 employees. And, how will the recent stimulus packages help them and help them make it to the other side of the crisis? And I think we have the same question for the Canadian suppliers as well. And what is potentially the impact on long-range employment or short-term employment?
Colin, you want to start with the...
Yeah, absolutely. So the Canadian federal government hasn't announced any specific packages per certain sectors. They've literally given out blanket statements which support everybody that's employed or was employed is now potentially laid off. And so we have the up to 75% of your salary being captured and covered for SMEs, for small and medium-sized enterprise employees, of those that are earning 54,000 or less. Canadian, and we have employment insurance. My wife works in that sector, and so without having to create the whole application process, if you are now let go, or if you are sitting at home because you are laid off, then you are getting 500 a week, 2,000 a month for, I believe it's 2 to 3 months, and then I think as we go through this process, depending on when we all come up for air, things will change, and I think things will get adjusted. But it is a broader package and definition versus one specifically for our sector.
Sure.
In terms of the small businesses in the U.S., we across the board, we have the unemployment, the $1,200 that's going to each individual, the monies that are being allocated per individual. But for the small companies themselves, the SBA loan program, which addresses companies that are qualified as small businesses, allows them to go in and borrow money to sustain their business. There is some opportunity within that package to also have that loan forgiven. There are, of course, terms and conditions and things that go with that. but it really is in the effort to allow these small businesses to be successful over the long haul.
And Julie, you had mentioned earlier that, this is truly a North America issue. The thought of returning back to production again, it requires Mexico, Canada, US to all be in sync. It can't be a hodgepodge because our sourcing and supply chains are so intermingled together. When we look at what's happening in all the countries, including Mexico, Mexico is a little bit, well, not so vocal as we are in terms of being proactive right now with social distancing and other things. What does that mean, or what could that potentially mean, and how can we do maybe a better job of supporting our Mexican operations, or what are you doing as part of in your role to try to facilitate this commonality amongst all the regions?
Well, we have seen Mexico in the last 48, 72 hours get much more active in terms of the government and putting regulations in, putting stop work orders in, defining what is essential businesses. So we have seen that begin to happen. The challenge for us will be, how are essential businesses defined, and is automotive part of that? And looking at that, we need to be able to understand what Mexico is supporting in terms of allowing businesses to come back online, so that we can plan and define how the rest of the North American region comes back online. So we need to work together from that standpoint and ensure that we have a strong and as rapid as possible safe start. And that's really challenging, because you're balancing safety and the employee safety, as well as the need, obviously, from a financial perspective, for these companies to get moving. Not just because the companies need to generate the revenue, but because the people there need to work. And we really need to enable that to happen as quickly as possible. So that's why when we talk about it, we need to have that communication and work together. I think the challenge will be is understanding how this pandemic is going to play out in the region. And frankly, we don't know yet. We have data, and we learn new things every week, every day, about what's happening and where we're going with it. The lessons we're learning, the guidelines we're putting forward for plants and manufacturing assemblies are not unique to the US or any particular country. They can be used and are being used in terms of changing the Mexican facilities and making sure that they're ready to go when startup occurs.
Can we talk just for a minute about what are we doing in those facilities today that we're starting to make the medical devices in those makeshift assembly lines? What are we doing in those workplaces today for those UAW and CAW workers that are coming back voluntarily? What are we doing differently to help enhance their safety and their medical awareness?
Well, I think what needs to be done is there needs to be testing of individuals. One of the things that we spoke about yesterday, Carla, was, what are our plans for when, the OEMs all go back and then the supply chain goes back to work. If we use a scenario of an assembly tier one, a manufacturing facility which has 500 employees, if an employee is tested positive for COVID, what does that 500 employee manufacturing facility do? Do they A, send all 500 home, which affects the economics and the manufacturing and the distribution of goods? Or do they send only those people that are associated with the individual and maybe the cell within where the individual may have worked? Question mark, question mark, question mark. So one of the challenges going forward, and I guess it alludes to those companies that are helping to build medical devices, is how do we track individuals that have it? Because I think the one lesson we've learned is the South Korean individual number 31, who kind of spread it to 800 versus only spreading it to 3. So things, we had a conversation with the federal government here in Canada and a large telecom as well as Microsoft about developing something similar to what Singapore introduced, calling Trace Together. It's an app. And it tracks using a random ID number. They don't track your details, your name, your date of birth. They just ask, they track your cell number, and you're provided with an ID number. And when anybody comes within 2 to 5 meters of your vicinity, they are automatically tracked. And so tomorrow, if I tested positive, they would know exactly who to quarantine. The challenges we face, let's face it, is our privacy laws in North America are nothing like those, say, in Singapore and other parts of the world. So how do we make sure that we implement technology, let's say, to help with the next phase, but also not step on other people's toes and their privacy and what they feel is right or what is wrong? But the fact is something needs to be done, because I think that's a calculation that people are still doing to say, if we all go back to work at the end of April and one person in a plant of 500 gets it, what do we do?
Yeah, Julie, and maybe you can give me a little more information on this. I heard vaguely about some of the things that are being done in some of the facilities, like getting rid of door handles and making drinking fountains and things touchless. Are these things, can you elaborate a little bit on that? And then does this portend changes for the future when we actually go back to work?
To answer the last question first, I think it does. I think fundamentally we're changing society in many different ways, not just in terms of the manufacturing and how that's done, but healthcare is going to change, health insurance is going to change. Many aspects of the ways we live will be changing. But in terms of the manufacturing facility, yes, touchless doors, touchless water fountains, using the ability to eliminate or create the right social distancing on the manufacturing line. So some manufacturing lines are actually being modified to allow for that, or they're creating barriers such as plexiglass barriers between the workers where they cannot create an appropriate social distance. I see lunchrooms and canteens being reorganized in order to socially create the right social distance between people when they are at lunch. There's a whole set of cleaning standards that need to be implemented, both on a daily, sometimes hourly, daily, as well as a deep clean. Should you have an outbreak or should you have something where a transmission occurs. You have to have emergency protocols in terms of how do you handle that? Say someone's on your manufacturing line and all of a sudden it's very apparent they are ill. You have to handle that in an appropriate manner so you don't contaminate, if you will, the rest of the organization and the plant. So there is a whole list of things that are happening and being looked at by manufacturing. I do want to touch on one of the points that Colin made, which was just the initial screening. Is it employee self-screen? Is it done as the employee enters the building? You can also then create zones so that you have distinct areas of employees that don't cross and intermingle with each other. And so in the larger facilities, they're looking at how do you do that? How do you stagger shifts? What do you do there? So there's like I said, there's a whole lot of planning that's going into being able to restart these manufacturing plants.
Sure. Did you have anything you wanted to add, Colin, or I'll move on to my next
Yeah, you can
question.
move on. I think Julie hit that one out of the park.
Okay, in terms of, opportunities for innovation, I just, keep thinking about touchless vending machines and all these things that have been in the plants forever, and coffee mug sanitation and all this. There's just so many opportunities now, I think, for for innovation. One of the questions that came from the audience is related to, now that we're starting to do some of this work in the medical industry, does this open new revenue streams for some of the companies that are in your organizations?
Possibly,
Has
I think.
anybody thought about that, or is it just, we just got to do it now?
Well, it's safe to say that when we talk to a lot of these medical companies to help them ramp up their volumes, one of the concerns was, what's going to stop you from deciding to stay in this and become a competitor? To which you have to answer that that's entirely up to every individual company, but only share the IP which you feel you can share. I've been saying it for many years, for probably 2 decades. I really don't understand why our sector doesn't diversify its portfolio. We used to have, before 2008 and 2009, we used to have those kind of 5.5-year cyclical periods where we'd hit our flat out and we knew how long that would typically be, and then we'd be ramping up. And so, it always used to bewilder me why we weren't kind of, making tea bags or diapers or something else in that period. But from an innovation standpoint, I think just like thermoforming, vacuum forming came out of building the canopies for the Spitfire in the UK back in the 1930s, early 40s, I think there will be manufacturing process innovations and product innovations coming out of this. My responsibilities are to help lead connected and autonomous vehicle technology for Canada. And I've challenged my sector, my subsector, I should say, to say, listen, the reason we're all getting into autonomous was because 94% of all accidents are human error, and it's about safety. And so now, how do we take the autonomous technology, IoT technology, and build maybe bots or smart door frames, which are providing a mist and desanitizing us as we walk into an environment? Or, why does an individual have to come up to you and put a thermometer on your head when a robot, an autonomous bot, could do this? And provide kits and provide sanitizing, gels. And so I do believe there will be an influx of new innovation because of the period we're going through. We're working with some of our existing members who are building reusable, washable face masks with cartridges that can be removed and replaced. And so the whole mask in itself is an N95, and you're using a fraction of the material, but just the localized portion of the respirator has the desired material, and the rest of it could be a fabric or it could be a silicone. And so we do definitely see potentials of innovation, but I would really like to see how we take the bot side and the autonomous side and really help to provide some of the safety back to all of those things Julie just mentioned about how the working environment will change and should change.
I think that those are some excellent points, and we've been studying here for some time about connected autonomous vehicles and what that's going to mean in terms of being able to make them germ-free and smell-free and odor-free, developing different fabrics. And a lot of that technology, even the UV light technology that's being deployed in airlines, can also be deployed when we talk about autonomous connected. And I think this does open the window when we think about the future. And I think it's also going to change about the way we think about autonomous connected and how some of those services are going to work, if indeed we'll turn into a sharing economy, as we've all been predicting for a long, long time. I have one final question because we're down to the last 3 minutes, and I'll read it verbatim. With many OEMs tier ones working on the ventilator crisis, is it resulting in a large amount of effort duplication? For example, certain component suppliers, blowers, filters, etc., being approached by multiple different sources for the same project. It looks like maybe this is causing a bit of chaos for those of us trying to help. Are there any thoughts on how the auto industry could try to mitigate it? I don't know if you're seeing something similar with the works that you're doing, and if so, what are those opportunities? What should we do differently?
I can't speak to the actual sources that the OEs that are manufacturing those ventilators have done, because I'm not aware of who they are specifically. But one of the things we are doing is working to better understand what the capabilities and available capacity is within the supply base, and make sure that that is part of the broader understanding of what's available in terms of capacity in the industry. And I mention that because we've been coordinating with NAM, the National Association for Manufacturers, and doing a survey to better understand that and get that information to FEMA so they can begin to source. So we are working hard to try and eliminate some of that chaos, to your point of perhaps multiple requests to do very similar types of things.
Good, good. And Colin, any secret sauce recipes from Canada?
I think the challenge is, the companies that I mentioned at the beginning that have teamed up to help build or upscale O2 Medical Technologies ventilator, we find is strategically the best way for it to occur, where not one single supplier or tier one has the responsibility. Rather, they can share their expertise, i.e. From casting, from molding, from injection molding, from bending metallics, and building semiconductors. So I think there is a higher demand of those that want to help, and probably a minimal amount of companies that can actually do with the help. But I think hats off to Vantec and General Motors teaming up, to Tesla and to others that are beginning to kind of develop. But the call is still there. As we talked about certain numbers, Canada is 3/4 of the way to making the volume of ventilators it probably will require. And so I think the more that medical companies can step up and say we need help to upscale, the better it's going to be for everybody.
Thanks so much. And one last question for you both. Is there a place on each of your websites individually that kind of has a place for all these heroes from the automotive industry that are stepping up, their names or their companies are listed? And if there is, just say yes. If not, will you think about doing that? So this came from a reporter, so the companies can be recognized.
We can
Yes.
certainly think about doing that. And we do have an information page at oesa.org that you can find out about what is happening and key information for the coronavirus.
It's same here, apma.ca, that's apma.ca, as well as follow Flavio Volpe on Twitter. He's on that thing 18
He's
hours
very
a day.
active.
18 hours a day, and it's great reading for all.
Well, Julie and Colin, thank you so much for spending the last hour with Center for Automotive Research and our audience. As a reminder to those who joined, the webinar will be available on our website immediately following. And I thank you so much for joining us today. And, just hats off to everybody in the automotive industry who's really fighting this war and providing equipment for the arsenal of health. Thanks a lot.
Thank you, Carla. Thank you, Colin.
Thank you, Julie. Thank you, Carla.